Good morning, doctor.
Okay. Today we are going to discuss the material topic. Good morning, Ilona. Okay, the material topic. Okay. So here, what to be able to understand the material, we need to know that we here have a body, we apply a force, and that body is reacting, okay, upon this force. If I'm hitting a body, it will move forward, okay? But if I hit the body with a less amount of force, it may slide, tilt, okay, or doesn't move at all. So I need here to know what exactly is the body to be able to apply the equal force to be able to move it, okay? Where exactly I'm going to hit the body, okay, it will move, okay? So here, first of all, before we are digging into more depth into the material, we need to know what are the stress, okay? First of all, the stress here, this is a force applied on a body, releasing internal resistant force in the material. I hit a force on a body, the body itself absorbs this force in the form of the energy, okay? And here, the body reaction will be the displacement or deformity regarding the amount of stress here, okay? So if the body here rebound to the original shape, it has elastic property. So what is the mean here by elastic? Let's say that I have a rubber, elastic rubber.
Sir,
Okay. Yes.
Yes, ma'am.
Thank you. Thank you. Do you see my screen? Okay. So here, now we have two kinds of material, right? The one who, when you hit it, it will rebound to its original shape. Okay, so it will be elastics. And the elastic property here mean the flexible one, okay? The flexible one. Here, if you have a night-tie wire, okay, you are giving him a little amount of force, okay? Then it will be back because it have memory shape. It will preserve the amount of force inside him, like an internal stress, okay? And after you tie it, okay, he want to get to its original shape. So it's working by the deactivated form. It will release the energy to realign the case, okay, to align the teeth. Here, this is the elastic part. I give the material force, it's coming back, okay? So this is the elastic one, okay? Others, when I give it an amount of force, okay, it doesn't rebound, it moves, or it deformity, okay? You either move or deformity. So this is the plastic part. It has no memory shape, okay? We need to know first the type of stresses. We have the tensile one, the compressive one, and the shear one, okay? What about the tensile one? The tensile one here, they are two forces on an object opposites in direction, okay? So it's like two people handling a body and everyone is going in opposite direction. It's like a coupling force, two forces opposite in direction, okay? What about compressive, okay? A body in the middle, and me and Rahim are giving the amount of force in same direction. So if we have a ball here, and I only have in my hand 50 gram of force, and Rahim have 50 gram of force, if I only hit here, me only, hit this ball for the 50 gram, okay, it will move a little bit, right? If me and Rahim, 50 plus 50, okay, it will be 100. Hitting the ball with the all amount of force we both have, it will move far away. Okay, so here two forces towards each other, they completing each other, they helping each other. But tensile, two forces opposite each other. Okay, pulling here. Okay, what about shear stress? Okay, they are opposite forces, sliding opposite forces against each other. Okay, against each other, but on the same plane. Okay, what about stress and what is strain? Strain here is the ratio of deformation to original length. Means that I'm hitting here an object with overestimated kind of stress. Let's see here, say that the ball here needs to be moved by 50 grams. Okay, I give it 150 grams. So what's happened? The ball deformity, it shrink, it's rubbed. Okay, so it doesn't move. I got it stuck here. In our orthodontic field, it means what? Okay, it means the heavy forces or heavy pressure tooth theory. Okay, the tooth movement. When I give the teeth more than force than it should to be moved, what will happen? No, thank you. Okay, what will happen? It okay. Okay, so what will happen here? It will deformity. Okay, so the teeth got stuck. The periodontal ligament has no blood vessels. It collapse. Okay, it prevent here the tooth movements. Okay, so the ratio of deformation to original length, it's I given the body more force than it will withstand. But what about the stress? Stress here means equal to the word force. This is the force I applied over an area, okay? To give me the amount of movement or the amount of load I need. Is it clear for everyone?
Yes.
Jupek, is it clear for you? Abrar and Laila?
Yes, doctor.
Okay. Abrar, Laila?
ايوه يا دكتور.
Okay. Excellent. Okay. So now we have a relationship between the stress and the strain. Okay. So is it necessary, Rahim, if I'm hitting a body with amount of stress, it necessary move? Huh?
Again, ma'am?
If I have a body now, okay?
Yes.
I now have a stress strain curve. Okay. I have a relationship between the stress and the strain. Is it necessary when I give a body the amount of force it necessary move?
Yeah, so that we can know whether it is going back to its original position without any permanent
But it
deformity.
doesn't. Here we didn't answer like this. Okay, I'm giving here the body the amount of energy, but it doesn't need to be moved. It may deformity. I need here to know the material of the body, the weight of the body, the direction I need, the type of movement I need to be able to move this body by the amount of force is necessary. So sometimes I may give a body a huge amount of energy or stress and it fracture, right? So it doesn't need to be moved. Sometimes it moved, sometimes it get back to its original shape, and sometimes it's a fracture. Is it clear? So I need here to know how to balance between the stress and the strain, okay? So here, let's memorize these parts, okay? This is the line of stress and this is the line of strain, okay? So the amount of stress I give to the material, it will appear like here, okay? So now we have here two columns, okay? Here is the range of the spring back, okay, or called the resilience. What is resilience here? This is the amount of force I give to the material and stuck in it, okay? The stored amount of energy. This means the resilience, okay? So in this part, all of this called elastic limit or proportional limit. What is this? This means when I give the body amount of energy, it is stored, okay? And then it will release the stored energy coming back to its original shape. So it will be the elastic limit or proportional limit, the releasing of a stored amount of energy to gain to back to the original shape, okay? Like what? Like the night eye arch wire, okay? Is it clear?
Yes.
Yes.
Excellent, okay. So this is the elastic part or proportional limits, okay? طيب. What about here, the yield point, okay? Here, I gave the body amount of energy, but it just start the deformity, okay? To bend. I just hitting on the body with a little bit more of energy that lead to what? Bending, deformity, okay? The amount of deformity here is what? Is 0.1, okay? And here, it means that I have applied amount of stress that is beyond the elastic limit. Here the body starts to bend or deformity or take another form, okay? Is it clear? After the yield point, I have here, just a second to open my oven. Okay, after here, the yield point, I have here the ultimate tensile strength. It means what? Okay, it means that this body stored a lot of energy, okay, after applying a little bit of stress. And what will happen? Okay, it become weak, it neck, okay, it's going to break, okay? So let's tell the story from the whole beginning. Here in this part, okay, I give the body the amount of energy and it's going to be stored because it's proportional limit or the elastic limit. During the releasing of these parts of energy, it's going to heading back to its original shape, okay? So this is the elastic part. Okay, good. What about the yield point? Here, I gave a little bit more of stress. It become to deformity. A little bit deformity happen, 0.1, okay? But what else? The ultimate strength here, due to the recurrency of yield point, I give a lot of stress and it become weak. A lot of stress, it become weak. A lot of stress and it become weak. What will happen? The ultimate stress, tensile strength, okay? It's when I apply a little bit of energy and it become to bend, okay? A little bit of stress and it become to bend, okay? What about here, the spring back or the range? Okay, the spring back here, this is the recovery process, okay? When I remove or the amount of stress I apply to the material, okay? But it doesn't mean necessary it's going to its original shape. Like what? I have a crowding case. And here I align all the case. I put 12 night eye, okay? For the first month, you will notice a little bit of improvement and the wire will have a little bit of deformity, right? But yet, after you press on the wire, it's coming to its original shape, right? Right? So here, it takes time to be on the original shape, okay? So spring back here. I apply force, it will release the energy. It will lead to a little bit of deformity, but if you leave him for a few more hours, you will come back and find it's in original shape, okay? Is it clear?
Yes.
Excellent, okay. So here, let's make it more simple. This is mean what? The amount of deflection that wire can go through without going in permanent deformation. Okay, so I hit the wire, it bend a little bit. After a few hours, it come back to original shape. So the amount of stress energy here, it's getting out over a long period of time. Okay. What about the resilience here? As we mean, resilience mean stored energy. The amount of energy is stored in the wire to be able here to move the tooth into the lining space. Okay? Okay? Okay. What about here the modulus of elasticity?
So, madam, after the proportional limit, whatever is energy is given, that will be converted into a stored energy, right?
After proportional limit, it's equal to the elastic limit. Okay? It's
Yeah.
going to be the yield
Beyond that, yeah.
the yield point. What is yield point here? This is the amount of wire, okay, going to do the same job with a little bit of deformity by 0.1, okay? If you are giving the wire more than energy than it can withstand, after a while, it will give you what the ultimate tensile strength. It will begin to be weakened. After that, are still giving him the wire a lot of energy. It's going to be the fracture point. Okay? So
Okay.
here, the yield point is the first point you are going to notice that you have 0.1 deformity. Okay? Is it?
Yes.
Thank you.
This is.
Okay. What is here the modulus of elasticity? Okay. What is here the modulus of elasticity? Anybody? Okay. The modulus of elasticity here means what? Okay. Means the ratio of stress over strain. Tamam? And here it giving me the idea about how the material is going to handle this. Is it going to fracture? Is it going to be stiff more? Okay, so increasing here the modulus of elasticity means more stiffness. Means what? More stiffness. Okay, so there is a huge difference between the amount, what elasticity mean and what modulus of elasticity mean. Okay, so Layla, yes, what is the difference here?
And modulus of elasticity is the amount of stress over strain. And it tells us how much it undergoes any deformity, if it can go back to its original shape.
The modulus of stress here is what it's giving me the indication about the stiffness of the wire, because modulus of elasticity is, I mean, a stress over strain. So when I increase the stress, if it's going to handle it, it's a strain. It's
Yes.
going to be stiff. Okay. So modulus of elasticity here means the stiffness of the wire.
Yes,
And
yes.
what about the elasticity, Rahim?
Elasticity means the capacity of the wire to
Mm.
go back to its original position without any deformity.
Without any deformity. And if it cause a little deformity, so it will be called yield
The
point.
point.
Still hitting it and give it a lot of energy and start to bend or start to be weak, it's called ultimate tensile stress.
Ultimate, yes.
Yeah, it's it's giving a lot of strain without showing any kind of stress. Okay? Lead to
Okay.
what? Lead to what? Lead to the fracture points, because here the material is keep storing a lot of energy. Okay? So a lot of energy over a lot of energy over a lot of energy, and with no reaction, here the material is going to explode. It's going to bend. Okay? This is why I always mention, please let's apply it on the tooth movements here. You need to know exactly what type of tooth movement to be able here to give the amount or the optimal force for this tooth movement. Okay? Is it clear? Why? Because if you give a over stress or a lot of force over the tooth, what will happen? The tooth get stuck, hyalinization zone will happen, necrosis will happen, no tooth movement will happen, and here to the material will start to bend, fracture. So I have a side effect on both. Okay? No tooth movement, loss of material. Is it clear now?
Yes.
As we mentioned, this is a quick questions for you all to be able to make sure that you get this stress strain curve. Okay, in which parts here? Okay, which parts here? Okay, the tooth will be back to its place.
An elastic limit or proportional limit?
Yes, this is called the spring back parts. Okay, spring back. In this spring back, because it's loading the amount of energy and regaining into the normal shape, right? So here the tooth is fixed about the deactivation force, the deactivated energy stored in this wire. Is it clear now? What about formability? Okay. The formability here, this is the ability of wire to bend, to give me the exact movement I need. Okay? Okay. Which means here I need to do, let's say, a ballista loop, okay, on a stainless steel wire, or any kind of loops, any whatever. Okay? So here, I need here to apply amount of force that bend the wire without leading to the fracture points. Okay, so here I need to bend the wire a little bit to do the ballista loop and the loop former to do the loop. So I'm going to do it smoothly because I know what kind of material I'm working. Here in this part, it's giving me the type I need, even you are going to do the finishing artistic bend. Okay, any kind of bend you need will be happen here before it's going to the fracture point. Okay? Is it clear?
Yes. Yes.
Okay. So here the permanent, here the bend, it's called what? The permanent deformation. Okay, here the permanent deformation happen is my favor. Is it in my favor? Why? Because I need this bend to happen. I need to make this bend. Okay. What will happen if you are going to do bend, Rahim, and you exert a lot of force? The wire get fractured, right? If you bend it
Yes.
more than it needs, it fracture. And this is what will happen after. If you give the wire a huge amount, you exert a lot of effort to make this bend, okay, the wire will fracture. So I need to give the wire the proper amount of force to give me the bend. Okay? Is it clear?
Yes.
Okay. So here, what is ductile? Okay. Ductility here means this is the ability of the wire to go a large permanent deformation, a large huge of bend, okay, under tensile stress. What is tensile stress? Two opposite force, okay, far away in opposite direction without any kind of failure, without any kind of deformity, okay? But what is malleability? This is still the ability of wire to go through permanent deformation under compression stress without failure. And this is when two opposite force towards each other, okay? And joinability here, this is the ability to weld or sild the wire, okay? And make it fuse as one part, okay? Okay. Now we are going to talk about the materials, okay? The materials, the polymer and the monomer. What does I mean by polymer and what does I mean by monomer? Polymer here, this is what's happened in the group of molecules with each other. It's called polymer. Monomer, this is one part alone, okay? So one molecule, it will called monomer. A lot, it's called polymer, okay? Both together, okay, to change from one to a lot, from monomer to polymer, it's going under the process of polymerization, okay? Is it okay? Is it clear? Now I need,
Can you explain again, ma'am?
okay, we now have one molecule and we have a group of molecules, right? The one molecule here is called the monomer. The group of molecules here called the polymer. I need this one form it to the polymer, a lot of molecules. I need it to be a lot, okay? So what will happen? Okay, I'm going to doing the polymerization process, which is adding, okay? Adding additional polymerization. I'm going to add something called activator. I'm going to this one plus this one, it's going to give me 1, 2, 3. How it's happened? I give her a little bit of push. I give her a little bit of activation material to changing from 2 to a lot, okay? To produce a lot. Is it clear now? The acrylic here, okay, we use it in many of the appliances, the removable one, the function one like trim block, okay, either it's heated or cold cure acrylic, okay. The heated part here, the heated cure part, it's the base material of the trim block, and when we are going to reactivate the trim block, we are going to add a cold cure acrylic, okay. So here, the monomer here, which is the one molecule, okay, it contain what? It contain the activator part, the liquid, and the powder are mixed together to give me the polymer, right? Okay, the mixing processor here is polymerization. Sometimes it leads to polymerization shrinkage, okay? And we have two types of here of the acrylic, either the cold or the heat or the cold one, okay? Just a second, please. What about here the heat? The heat cured acrylic. Okay, now we know that we have the acrylic. It have liquid and powder, right? And we use this material in the formation of the appliances of the orthodontic appliance, like the trim plug. Okay. To be able to gain a proper portion, you need to mix the powder and the liquid. Okay. Here, if you are going to mix the both of them together, you are going to degrade the amount of polymerization shrinkage to 7. Okay. But if you are mixing the monomer alone, okay, it will here give a lot of polymerization shrinkage. Okay, so we need to mix both in the proper amount, okay, to give me the wet sand appearance, okay, and here when applying both together in the proper amount, it will decrease the polymerization shrinkage. Okay, heat cured here need a lot. It's used in the heavy forces appliance. Okay, I needed to do it for 16 hours in 72 degree for 3000 kilopascal. Okay, we need to pack it under pressure, okay, to reduce the voids. This is why when you are pressing both each together, you are applying a lot of force during pressing with the spatula to relieve the voids, right? Okay, what about here the impression material? What types else we have in impression materials? Just a second. Okay. Here we need to know what are the properties need to be able to use the proper impression material, okay? I need here before insertion to make sure that what are the material cost? What are the ingredients inside the material? Is it easy here to be used or need a lot of share time? And the shelf life, okay? And during the, while you put it in the patient, what properties I need here to observe? I need to see, is it biocompatible? The patient accept it or not, okay? The flow of the material, okay, to avoid any gagging reflex happen to the patient or discomfort happen to the patients, okay? Is it going to here withstand the temperature of the oral cavity, the atmosphere and the acid field in the oral cavity or not, okay? Is it going to handle all of this and nothing change, okay? And the most important, how it's going to be in the oral mouth, for how long, the sitting time, okay? Is it going to, I'm going to put it in the mouth and leave it for 15 minutes, or I'm going to put it in the mouth and remove it in 2 or 3 seconds, okay? And when I'm going to remove it from the patient's mouth, I need to take care of the flexibility of the material, okay? The amount of tears that might happen, is it when I'm going to remove it, it's going to tear and deformity the shape I have, or it's going to maintain the shape even during removal, okay? And after removal, I need to check what the dimension stability, okay? And if I'm going to apply disinfectant and wash it before using to the lab, is it going to deform or change something here in the material or not, okay? We have 2 types, the most common, and now by the huge technology, we don't use this anymore. We are going to do intraoral scanner, which is more easier, okay? We have the alginate material and rubber-based material, okay? Here, what about the alginate? Okay, the alginate here, this is called irreversible hydrocolloids, okay? The colloid here means the powder, it's a solid state. It may change to gel under what? If you are going to heat it, okay? It's going to change to gel if you are going to increase the heat, okay? But if you add something like a chemical reaction, it will be irreversible. It not will be returned back to its original shape. Okay. What are here the component of the alginate setting material? It will be the potassium alginate, calcium sulfate, and water. This is the border. Okay. It gives me what? Calcium alginate, potassium sulfate, and water. It will release water. Okay. Here, the sodium alginate with calcium sulfate, it will give me what? Calcium alginate, sodium sulfate. So I have two types. What here? Why we have two types here? Due to the extent of time, which is better to give me the proper working time. Okay. What about here the component and what is important? Here, the potassium or the sodium alginate, it will dissolve in the water. It make it easy to dissolve in the water, okay? When you mix it with water, it became the flowy, okay? Calcium sulfate, okay? It reacts with the alginate salts itself, okay? And it changed it to insoluble calcium alginate, okay? What about here, the sodium phosphate, okay? It will react here with the calcium sulfate to extend the working time, okay? Potassium sulfate, it counteracts the gypsum setting, okay? To avoid, to be toughness in a short period, okay? What about here, the rubber base? The rubber base, it's not, it's like a rubber, it's a rubber, okay? Elastometric material, okay? And we have to apply those to allow this material to work, okay? The activator and the lights, I need to apply those to allow this material to work, okay? And it works by condensation or additional. What is the best? Is the additional, okay? Not the condensation. Just a second. What is the difference here between the conditional silicon and the additional silicon? Okay, condensation silicon here, it releases amount of alcohol that increase the dimension, it changes, okay, and lead to less stability, which lead to what? Less accurate. And this is because it's a cheaper than the additional silicon. So here, the condensation part, due to the amount of alcohol it releases, it will compromise the dimension stability I have, okay? And of course, will it change the structure I have in the tray, okay? But what about here, the additional silicon? Additional silicon here, this is the most expensive one, okay? Have minor dimensional change. Why? Because there is no alcohol here to release, okay? It release what? It release hydrogen, okay? And this kind of hydrogen that it released, it's going to tough the material up, okay? Is it clear? So here, it release alcohol, causing deformity. Here, it release hydrogen to tough the material up. Here, it will compromise the amount of stability I have. Here, it enhances the stability I have. Is it clear now what is the difference between both?
Yes.
Okay. What is here the working time? Working time here for alginate, okay, it will be 1.25 to 4.5. The setting time, which is more important in the patient mouse, it will be from 1.5 to 5, okay? And recovery here from the deformity, it will be 98, okay? And here, this is the most important one. Is it going under tear strength? And how much gram of force, okay? If you are going to apply during the packing from 380 to 700, it's going to tear. And here from 1,500 till 4,300, okay? Okay, Layla, Abrar, Mahmoud, is it clear for all? Yes, okay. Okay. What about here, Dupek, is it clear for you?
Yes, doctor.
Okay. Just a second, please. About here the orthodontic cement, okay? How I'm going to, now I have the impression, I send it into the lab and it get back, then I need to cement this appliance, okay? Okay, what are the materials used here? First of all, we are going to use, we have a lot of material like zinc phosphate, polycarboxylate, glass ionomer, resin modified glass ionomer, okay? And we need to know the properties of each one, okay? Regarding here, the zinc phosphate cement, okay? First of all, it has the phosphoric acid, so it's an acid reaction phase, okay? Acid reaction base, this is number one, okay? See here, done by the mechanical, okay? The mechanical retention, not the chemical retention, okay? But it have one problem. This is a very brittle material, okay? If it goes with a little bit of tensile strength, it tear. So it has high failure rate, okay? And still, because it has no fluoride release, it's more soluble in the saliva, okay? And we should also remember during mixing this, okay, we need to do it in a cool glass, okay? Because it's an exothermic reaction. It gives me a lot of heat. I need to put it in a cool glass, okay, to be able to mix it together. So this is not the kind of material I need to cement, okay? It's a brittle, not soluble with the saliva. It have no fluoride release. Under stress, it's tear, so it's not that good, okay? What about the polycarboxylate? So polycarboxylate, it has the carboxylate, the polyacrylic acid, okay? So this is an acid reaction like the zinc phosphate, okay? But it's a chemical adhesive, not mechanical one, okay? It's compound to each other by the chemical, okay? It has a fluoride release, okay? And low fracture resistance, still it goes under fracture, okay? And the amount of fluoride here, it releases, it's just about 10 to 15%. So it's not enough, and yet it's still soluble in the saliva, okay? And it's still going under deformity. It's better than the zinc phosphate, but yet it's not the best option for the cementation, okay? This is, okay. What about here, the glass ionomer? Okay. This is a polyalkyl acid. So this is an acid-base reaction, okay? But it has a lot of acids, okay? It has the tetric acid, polyacrylic acid, and ectonic acid. So it has 4 types of acids. Okay. The first here, it's have due to a lot of acids, and here it's getting by the end result in the final, the calcium oxide, the calcium ions, it will be released by the end. It's going to increase here the strength of this material, and also it has increasing of the fluoride release. Okay. We have two phases of maturation. Okay, we have the gelatin phase and the maturation phase. In the first phase here, during the chemical reaction, okay, it releases the calcium, okay, because the calcium ion here, this is the lighter one to release rather than the aluminum, okay. So the calcium is the first one. During mixing, it's released, okay. After that, it's changing from the initial phase into the maturation phase. The aluminum here, it will release, okay? And helping in the setting time, okay? What about here? What is the function here of the tetric acid? Okay, it influences the working time and the setting time, okay? As this tetric acid increased, the working time increased and the setting time increased, okay? If it decreased, the whole process will be decreased, okay? What here is the advantage of this glass ionomer? Why it has the preference here? First of all, it can be adherent to the enamel, okay? High retention means because it's a lot of acids, releasing the calcium in the first part, in the initial phase, in the maturation, it's going to release the aluminum. All of this will help with the tetric acid. It will help me in the setting time and the working time, okay? It have the maximum strength after you leave it in the mouth for 24 hours, okay? More working time and releasing here the fluoride up to 12 months. So what is the important here of releasing the fluorides? It's a fluoride working against the caries, okay? So it's helping to protect the teeth against the caries, okay? But what about here the disadvantage? The moisture control, it has no moisture control. It takes a lot of working time, okay? And it has lower resistance, okay? What about here, the resin modified glass ionomer? Okay. This is the glass ionomer.
Can you show the slide before, ma'am?
Which one?
The earlier slide, the disadvantages.
The advantage?
Yeah. And there was one disadvantage also, something like that.
Okay.
Yeah, limitations.
This is the disadvantage, which is a short working time, okay? Long setting time D2, and all of this working under what? The tetric acid. If it's increased, it will increase the working time. If it's decreased, it's decreasing the working and setting time, okay? And low fracture toughness. It can't still yet, it has a problem in the oral cavity. After a while, it fails, okay? But the most important here, it can release fluoride up to 12 months. Okay, so it's protecting the teeth against the caries process, okay?
And the aluminum which is released will help in what you told something. It will give the strength.
Aluminum here is changing during the reaction from the initial phase to maturation phase, okay?
So what it helps, like that aluminum is helping in which way for the setting reaction?
I didn't get your question once more.
The aluminum is released. Is it helping in any way of the setting reaction of glass ionomer? No.
No.
Just it is released. That's it.
No, yeah, just from here to here, okay?
Okay.
About the setting time or the working time, okay, this is all about the tetric acid, okay? The tartic acid, okay? So what about here, the resin modified glass ionomer? Okay, just a second, I need to try. Okay. What about the resin modified glass ion? It's still yet it's the glass ionomer material, but I add a resin molecules. Okay, yet okay, it's still acid reaction base. Okay, just a second. Amal. Okay. Okay. So it's the glass ionomer with adding a resin modified molecules. Okay. And still it's an acid base reaction and increase the strength inside the oral mouth after 24 hours. Okay. And it has a fluoride less release than the glass ionomer. Okay. And it's here helping to adhere to the tooth by the micromechanical interlocking. The glass ionomer will be what? A chemical one, right? But here the glass ionomer will be the micromechanical interlocking, okay? So what here are the best material you are going to cement the appliance with?
Resin modified glass ionomer.
The what?
Resin modified glass ionomer.
The resin modified glass ionomer, yet you know that you have a problem, which is less release of the fluoride. It releases fluoride, but not great in greater amount like the modified, like the glass ionomer itself. Why it is the best? Because here's a monomer here. You are going to use in this resin modified glass ionomer is going to penetrate the surface and go and do a little bit of grooves, okay, to interlock with the teeth, okay, in more micromechanical, okay. This is why it's remain more in the oral cavity. It's a good in cementation of the appliance. I don't have any recurrence of debonding of this appliance, and also this is a good in what? In the moisture control, okay. The glass ionomer have a poor quality in the moisture control, right? The only problem here is that it doesn't release the huge amount of fluoride like the glass ion, okay? What about the bonding adhesive? Okay, just a second. Yes, okay. First of all, adhesion here can be mechanical or macromechanical. Mechanical, okay, or macromechanical by attaining to do a lot of grooves to do the interlocking here, okay. The micromechanical here, it's done by the H, okay. It will lead to micropores here, okay. The composite bond material, this is a micromechanical one, okay. The chemical reaction here, this is the reaction between the tooth and the material I'm applying on the tooth, okay. What about here the composites? What do you know about the composites? What type of composite you use in your clinic, Rahim?
Transbond XT.
Dubek?
The same one, ma'am. Transbond.
Okay. Okay. Layla?
3M composite.
Okay. Mahmoud wa Abrar? Okay, so now all of us use a lot of types of composites, okay? First of all, we need to know what is the composite. A composite is it's an enamel organic matrix, 4%, water So it's a hydrophobic, okay? Bond without fillers. I need to H and bond H to remove the smear layer, clean up the keys. I need to apply the bond here to be the junction between the tooth and the composite, okay? And to fulfill the dentine part, okay? To allow the composite here to attach, okay? We have here a lot of bonds generations. We have the chemical one, but it lead to a huge failure, okay? And we need here, we have to H and then bond, then apply the composite material, okay? This is 2 steps, okay? And we have the 1 steps with one bottle have to H and bond with each other, then applying the composite material. But what is better? Okay, according to evidence, okay, the 2 steps is better than the 1 steps. If you have the self-H, which is the H and the bond in the same bottle, like the 3M1, you need to do H first. If you apply this one, you will face a lot of debonding. Okay, so don't depend that you have the self-H. I'm going to put a brush and then cure it, then it will remove the smear layer, it will do micromechanicals to the dental tubes, I'm going to attach the composite to it. No, you will have a huge failure. So the importance here is to do the 2 steps. Even when you have the self-H, you need to do the H first to remove the smear layer, okay? How to H, okay? Tell me, Rahim, how you are going to do the bonding steps?
First, I will isolate, then I will do the scaling and polishing, then I will remove the smear layer by the cotton, then I will do the etching for 20 to 30 seconds with 37% phosphoric acid.
37, yes, excellent.
Yeah, then I will wash for 10 to 20 seconds the etchant. Make sure that the etchant is completely removed from the oral cavity. Then I will isolate again. I will dry the area to chalky white appearance of the enamel, and I will apply the bonding agent and I will cure it. Then I will
Cure it for how? For how long?
20 seconds. Then I will do the bonding.
Excellent. Here, so we are going here to use the 37% phosphoric acid to do the etching, okay, for 20 or 30 seconds, okay? And if we have enamel defect, you are going to cure for more, like MIH, aminogenesis imperfecta, fluorosis, you are going to H more, okay, up to 60 seconds, okay? Then, if you are going to only going for the enamel part, you are going to H for 30 seconds. If you are going for the dentine part, you are going to H for 10 seconds. Or if you, to avoid any harm, you may cause to the dentine, like dentine hypersensitivity, okay? And here, then you are going to rinse for the same amount. You did the H for 20 or 30 seconds, and then you are going to do the dryness till the chalky white appearance happen. This is the clean field, apply the bond, then cure it, okay? And apply the bonding material, okay? As how we mentioned, the self-H, which is the total H1, the H and the bond in one bottle versus the conventional method, which is the 2 steps, okay? The 2 steps is better than the self-H, okay? And according to Fleming, 2012, there is a weak evidence here in failure, okay? But there's a strong evidence that the self-H, okay, saves time. It's we totally agree in that. When you use the H and bond in the same bottle, you are going to save more of its chair time, but yet it leads to a huge amount of debonding. So you need to go for H, then bond. How to cure here the composite? Okay, you're going to use chemical cure or light cure one. Okay, and here the wavelength, it should be from 390 to 480 nanometer. Okay, what about here the adhesive remnant index? Okay, and this is done by Dr. Arnott. How to record? How to know if here, if the debonding here caused because it happened because of you didn't do the proper steps or because of the patients, okay? If you here find, okay, all the adhesive on the bracket base, like here, all the composite material here, okay, and we have no exposed of the mesh, which the mesh base here doesn't appear. This is where the adhesive material here lies on the mesh parts, okay? 1 here means that we have 50-50 of the adhesive material, okay? We have less than 50 on the bracket and the rest on the tooth. 2, we have here exposed more of the mesh base, so less composite material on the brackets, okay? And 3, the 100% of adhesive material is on the tooth, not on the mesh parts, okay? Why we here H? Why we are going to do etching process? First of all, to remove any smear layer and to create the micro grooves, okay? 2, when you apply bond, it will do the micro mechanical. So the smear here, the etch here have 2 purposes: to remove the smear layer and to create micro porosity to allow the bond to do the micro retention, the micro mechanical retention in these grooves, okay? So what we are going to etch here for 37% of the phosphoric acid for 15 to 30 seconds, wash dry for the same amount, then you are going to apply the bond, but before it, you need to dry it well to have the chalky white appearance, okay? If I have a bleaching enamel, okay, what should I do? Okay, I need here to delay the bond for 24 hours to 3 weeks. Yani I can do bonding to the recent bleaching enamel, okay? Because it will have a high failure rate. So if I have a patient recently bleaching, okay, I ask her to come after 1 month to decrease the failure rate of the bonding, okay? How I'm going to bond to the porcelain? If I have a crown, okay, first of all, I'm going to do some roughness here on the porcelain and use 9.6 hydrofluoric acid for 1 moment to remove the glaze after I do the roughness, okay? I'm going to rinse for 30 seconds, dry, okay? And here the material we are going to use instead of the bond, it's called the silane bond, okay? The silane bond, okay? Then I'm going to cure, apply the composite and cure for 60 seconds, okay? If it's a zirconium, okay, we are going for the same zirconium crown. We are going for the same procedures, but instead of using silane bond, we are going to use the zirconium prime bond, okay? If I have an amalgam, what should I do? I need to do first a sandblasting to the amalgam, okay? Then I'm going to use the amalgam bond plus, okay? To be able to bond on the amalgam material, okay? So what will happen if I have a gold material, a gold crown, okay? Here I need a high bond material, okay? I need to do some roughness with the diamond bear, okay? Then after the roughness, I need to do the sandblasting, okay? And I'm going to apply the high bond material I used with the bond. If I have any defect in the enamel, like fluorosis, aminogenesis imperfecta, MIH, I need here to increase the etching time more than 60 seconds. And using, instead of 37 of the phosphoric acid, I'm going to use 40% of the phosphoric acid for 60 seconds. So here I'm going to increase 2 things. I'm going here for 40% of phosphoric acid instead of 37. And if I'm going here for enamel defect, I'm going to etch for 60 seconds, not for 15 to 30 seconds, okay? Is it clear now?
Yes, yes.
Okay. What about here the orthodontic brackets? Okay. What are the types here? What are the type of brackets here? We have the metal one, we have the ceramic one, right? We have the plastic one. So what are the methods of fabrication? How it's formed? By casting, milling, sintering, metal injection, molding, okay? What about the casting here? Okay, I have the alloy. I have the metal alloy in my hand. It's melted, okay? It gives me a liquid. I'm going to pour this liquid into a mold to give me the shape of the brackets, okay? It can be used for one piece or a lot, okay? After this, I'm going to weld all of this component to give me the final shape of the bracket. I'm going to weld the mesh with the wings, with the inclined base to give me the final shape of the bracket. So in the casting, we don't get the final shape in one phase. No, I'm going to do it into more steps. I'm going to mold the first. First of all, I need to melt the material to give me liquid, put the liquid in the mold. Okay, this mold will give me the shape of the mesh base. Okay, then I'm going to take a lot of the liquid to put it in the shape of the wing. Okay, then it will give me the wing shape. Then after I do all the parts of the bracket, I'm going to weld it together to the final shape of the brackets. Okay, the problem here, it's expensive. Okay, the welding process, using a lot of molds, melting a lot of material, have a lot of loss here of the material, okay, and takes time to put one bracket together. Okay. Okay. What are else the problem here of the casting? Okay. As we mentioned, in the casting here, we are putting, it's like a puzzle. I'm going to collect all the parts and try to put it together. Okay. Here, during the puzzle process, I may have a torque problem. Okay. I may don't fix the part together in the inclined slots, okay, to give me the proper tipping, okay? Or I didn't put the mesh in the proper place. It may be upward, downward. It will affect here the tooth movement. So it's not an accurate method, okay? So the whole process here, it may also, it change the description in the practice, okay? What about the milling? It's more advancing. We're using here a machine, okay, to cut the shape of the brackets, okay? But it's expensive, okay? Centering, we here using the powder, okay? Into a mold. First of all, the first one, which is casting, I get a metal in my hand. Melt this metal. It formed a liquid. I pour this liquid into a mold. This is called casting, okay? Centering here, this is all about the powder. I put the powder in the mold. I put it under a huge amount of temperature, okay, to melt, okay? And they give me one single unit, okay? Now we know the difference between the casting and centering. Rahim, Dubek, Layla.
Yes.
Abrar, Mahmoud. Is it clear for all?
Yes.
Yes, ma'am.
Thank you. Mahmoud or Abrar, are you following me or are you missing something? Okay. What about here the melting injection molding? Okay. This is the most expensive method and the high-end cutting method, okay? Why? The high-end technology, okay? Because we are going here to design the bracket by using the CAD/CAM technology, okay? We use also here the metal powder, okay, which is called metal dust, okay? I'm going here to add a lot of lubricant, binder, plasticizers, okay, to give me a good mix with this metal powder, okay? Then I'm going to stick it and inject it in the molding machine, giving me the final shape by the end, okay? But yet it's still the most expensive one. During the heating process here, okay, after adding the binder plasters to the powder, okay, the heating here leading to removing 90% of the binder one, okay? What will happen? Okay, it's converting here, okay? It's leading to the shrinkage of the material. If I'm going here using a huge amount of heat, it's changing here from the green one part to the brown part and leading to the shrinkage. The material will be smooth, okay? What are the advantages here? Okay, first of all, we did it as one single piece. We are not going to collect it like a puzzle. So it gives me more precise, okay? Second, because we did all of it as one part, the wings here don't fracture rather than the casting parts. I don't have here any problem in the torque because it's made as one part, not as the puzzle collected parts, okay? It has high corrosive resistance, okay? And less friction. What about here the ceramic injection molding? Okay, it's similar. We have the ceramic powder. We are going for adding some material like binders, plasters, but here we are going to increase the temperature to 2000, okay? And it's the same. It's getting the bracket as one whole unit, okay? What are here the type of the brackets? We have the stainless steel one, the cobalt chromium one, the titanium one, and the precious material one, okay? The stainless steel one, this is made pure from stainless steel, and this is the number of the most hygienic one, 303, 304, 316, okay? This is the number of the system is a stainless steel alloy, okay? And here we can add iron or carbon to the stainless steel. So what are the components here? This is called 1828, okay? Chromium, okay, and nickel. We have here the ferritin for 18%, okay, and the chromium for 8%, okay? Why we are going to add carbon here to the stainless steel? It's giving more hardness and strength. Chromium, it will be resistant to the oxidation may happen, okay? And also, it prevents the corrosion to happen. The nickel, it's very important for the ductility in the material, okay? Next will be the cobalt chromium, okay? And here we are going to use the cobalt chromium if the patient have nickel allergy. This is an alternative method for the nickel one, which is found in the stainless steel, okay? Still, it can be done by the casting, and you collect the pieces to form the one piece, or by the metal injected by getting it at as one piece, okay? We use it in the patient with nickel allergy, okay? It has low nickel components. It's hardening than the stainless steel, yet it's less frictional, okay? Because of what? of the increasing of the amount of the chromium it has. The titanium bracket here, also we use it when the patient have the nickel allergy problem, okay? It's a nickel-free alternative. So we have two types to use instead of stainless steel. Stainless steel here it has a lot of nickel. So you have the cobalt chromium one, yet it have 0.5 of nickel. So it may also lead to a small kind of reaction with the patient of the nickel allergy, okay? And we have a total free nickel product called titanium brackets, okay? It has excellent biocompatibility, increased the corrosion resistance, and the titanium here also used in the material of what? Mini screw, the mini screw titanium 4, okay? And used also in what? The titanium in the artificial heart valve in the hip joints, okay? To overcome here, okay, we are going to use this part to overcome the problem of nickel allergic patients, okay? What are here the disadvantage? Maybe discoloration, okay? Lack of strength, okay? The plastic, this is the precious one, I think. Yes, this is the precious one, okay? The plastic bracket here. The plastic bracket here may be true translucent or transparent for petty aesthetics, okay? It's done by the plastic injection molding, which is getting the whole piece together, okay? And this is a good option when the patient complaining from the aesthetics or also have the nickel allergy, if you can't find the titanium one or the cobalt chromium bracket option, okay? What about here the plastic brackets? Is it good or not? Okay, here it has a lot of disadvantage, like because this is a transparent or translucent, it may face any tooth discoloration during eating, okay, of the material itself. Has high bonding strength. So during the bonding, you may fracture the enamel surface of the teeth, okay? How to overcome the problems here? Could you please give me a few moments? So how to overcome here the problems I need, okay? First of all, I have a problem with the plastic one, okay? So I need, first of all, to overcome the material problems, okay? By using one of the following, like what? The polymethylene, the filled polycarbonate, polyethylene brackets, and the hybrid polymer. So let's dig more into this, okay? The polyoxymethylene, what will happen? Okay, it have a better color stability. Write it down, please, after me, Rahim. This is very important in your exam, okay? Okay, so here the polyoxymethylene, okay, what it's good in what? Okay, giving me a better color stability, okay, and the physical properties, low frictional resistance, yet it releases a toxic material, formaldehyde, in the oral cavity. So it's a good on stability, but it's bad in the toxic release, okay? What about here, the filled polycarbonate? Okay, the polycarbonate here, okay, this is to compensate the lack of strength and rigidity from the oxymethylene one, okay? And also, we can add a metal component in the polycarbonate one, okay? To reinforce here the slot. So we can do here all the bracket from the polycarbonate, which is the composite, which is the more translucent, and coming to the slot, we are going to do with the metal one, okay? Why? This is will overcome the torquing problem, okay? After all, this is a plastic one, a translucent one. It may fracture, okay? It will not give me the proper bracket description that's present here in the base. So if you're changing it by adding a metal slot here, it's going to reinforce and give more strength to this type of brackets, okay? Okay. What about here? The evidence, okay? If you are going here to, we're here comparing about the slot deformity and the amount of torque applied in the pure transparent one and the one with the metal. They found what? They find that we have loss of torque and the slot deformity in the polycarbonate one, okay? Comparing to what? To the metal one. So we have a problem here with the plastic one. This is why in this particular composite filled one, okay, we are going to add the metal slot to preserve the amount of torque already prescribed in the brackets, okay? Okay, what about here the ceramic brackets? Okay, what are the advantage over the plastic and the metal one? Okay, first of all, it have high bond strength. This is a very good one. I have high bond strength, so it will debond rarely, but I have a problem regarding this part. When I debond it, I'm going to fracture the enamel surface of the tooth, okay? It has high bond strength, but the material here is weak. It may fracture, okay? It has a better color stability because it looks like the ice, pure, transparent, okay? More than the plastic one, okay? The ceramic brackets here have three components: monocrystalline, aluminum oxide bracket, polycrystalline, aluminum bracket, and the zirconia one, okay? What about here the monocrystalline, okay? As we mentioned, it's done by the milling processing, okay? So sometimes during the milling processing, it leads to imperfecta in the shape, okay? It may have more stress during the manufacture and it's still in the body. It doesn't release, okay? So the end result here will be a translucent and a colorless one. But yet we have a lot of energy here in the body. It doesn't release yet, okay? And the imperfecta, because it's done by the milling machine. What is the advantage here? Okay, clear, lower friction compared to the other ceramic. Disadvantage, low toughness. Okay, it can be fractures from the wings especially, and expensive. Okay, polycrystalline aluminum one. Okay, this is when you're binding the aluminum oxide with a binder. Okay, it will give you the proper shape, but it's less than the monocrystalline one. So the most transparent one will be the monocrystalline or the polycrystalline Dubec. Dubec? Rahim, what will be the
Monocrystalline.
what? Mono,
Mono.
excellent. So the most transparent and the ideal for aesthetic will be what? The monocrystalline aluminum one, okay? Not the polycrystalline, okay? It's the color here, it's more like a white, okay? White by adding the aluminum oxide particle, okay? It here compromise the look, the translucency, okay? Advantage, it can be molded, okay? So you can do a large amount, but yet you need to do the welding process. So it may have also torque problems, imperfect structure, imperfect, high fractional. And because we use here, we're adding the aluminum oxide particles, it's opaque, not translucent, okay? What about here, the polycrystalline zirconia brackets, okay? This is an alternative for the aluminum ceramic, okay? It have here high toughness, okay? Cheaper than the crystalline one, okay? But yet opaque and yellow, opaque and yellow. So among the three, Rahim, what is the most translucent one and the aesthetic one?
Monocrystalline.
Excellent, okay. What here, the advantage of the ceramic over the plastic one? Aesthetics, it's more translucent, okay? High strength bond, but lead to tooth fracture, the enamel parts, more resistant to wear and deformity, better color stability, okay? But yet it has a breakage probability, less fracture resistance, especially at the wing one, okay? Have high bond strength leading to the wearing and the shipping of the enamel during the bonding, okay? Is it clear?
Yes.
Excellent, okay. So here, if I'm going to use the ceramic one, what should I do? First of all, we need 2 degrees. We have mentioned earlier that we have high bond strength. This is a very good one because we have a rare debonding, yet we have a problem during the debonding procedures. It may shape the enamel, right? But what else? I need to decrease this bond strength. I may use doing mechanical retention grooves, okay? Decrease the silane coupling agent, okay? I may use the ceramic brackets, but with a metal mesh, with a metal base. So during the bonding, it will be easier, okay? I need here to modify the etching, okay? Because 60 seconds, okay, will be easier here to debond and not shape the enamel, okay? I can here bond, not with the silane or the bond of the 3M, I can bond with resin modified glass ionomer, okay? This is a ceramic one. What should I do in the debonding procedures? First of all, I need to use a safety glass because it's not going to remove by the bracket removal, okay? Sometimes I may use the contra with high speed to remove it, okay? I need to wear my protective goggles, okay? I need to trim the composite around if you have excess composite, which is not acceptable, okay? You need to check that you don't have any kind of excess composite to avoid any adjusting in the torque prescribed. Excess composite here lead to what? A changing in the bracket torquing prescription. Okay, so I need to make that I have a little layer of the composite and remove all the composite around the brackets here, okay? Then I need here to, okay, I need here to trim the composite, okay, before the debond, okay? And I need to use the specific plier for the ceramic bracket removal, not the metal one. I may need to use the contra with diamond bare, okay? Sometimes people can remove it with the laser debonding, okay? Ultrasonic, sorry, okay? So we have a lot of debonding methods. What about here? What are here the problems of the ceramic? First of all, we have increase in the frictional force. Increased frictional means what? Less movement, less sliding mechanics. So here, if we are going to use the ceramic one with the metal slot and the metal mesh, it will be the best option. I here have all the factors I need to be successful here. I have the metal slot, so less frictional, better movement, better sliding movement. I have here the metal mesh for what? For easy debonding, okay? Metal slot and metal mesh, completely torque prescription will be applied during the movement, okay? What are the other problem here, like enamel wear, okay? Because we have increased here of the bond strength, I need here to use, like we have mentioned, 60 seconds for etching, use a glass ionomer, resin modified glass ionomer for bonding, for cement, okay? I'm not going to use the silane bond, okay? And also to avoid the enamel wear problems, I need to use it in the deep bite. Deep bite, we have no occlusal stop. The teeth here is occluding to each other. It may lead to what? To the breakage of the ceramic brackets and to the enamel wear as well, okay? If I'm going here to using in a deep bite cases, I need to raise the bite or use anterior bite planes, okay? To avoid here, what are the problems also? I have the fracture part because I have weak wings, okay? The fracture of the wing parts, okay? This is a very weak one. Debonding. In the deep bite cases, the traumatic occlusion here can lead to the bracket breakage, okay? How here to decrease this fracture, okay? First of all, I need to use all the nitrile wire before applying the stainless steel wire, okay? To be able to apply the proper torque. And yet you will have loss of torque if you are not going to use with the metal slot one, okay? I need to do a careful ligation and avoid scratching the wings to avoid the fracture here, okay? Okay. If you need here to reduce the amount of enamel fracture, we need to avoid using the ceramic brackets and deep bite cases, root canal teeth treated, periodontal compromised teeth, okay, lower incisors, okay. If I have a badly enamel tooth like MIH, like fluorosis, like aminogenesis imperfecta, don't use it. We have already weak enamel, okay. We also don't use it in premolar for better sliding movements. If you are going for the sliding movement, please use the ceramic with the metal slot, okay? What are here the force delivery system? Now, we know from starting of the material, okay, we talk about the appliances and how we are going to do it either by acrylic, heat or cold, okay? Then the impression material I'm going to take, either it's alginate or rubber base, and nowadays we are going to use the IOS, okay? And the third, how I'm going to cement this appliance, and we use glass ionomer resin modified, okay? This is the best one. And then coming to the fixed part with the bracket, we talk about the metal, cobalt, chromium, titanium, and the ceramic and the plastic one, okay? Now, after I put all of this together, I need to put the wire. I need to put what? The wire, okay? So I'm going to give you just a 2 minutes break, and I'm going to be back.
Ma'am, can we do this tomorrow because our clinic is going to start now?
It's okay, no problem. خلاص, tomorrow in the morning we are going to complete the material part and start another thing, okay?